Last year, a record 93,000 people in the U.S. overdosed on drugs and died. The CDC on Wednesday shared the grim statistic. It represents a nearly 30% increase in overdose deaths nationwide from the year before. That's the biggest single-year increase ever. In Oregon, preliminary data show that 30% rise came from 799 overdose deaths. In Washington, they suffered a 37% increase with 1,724 deaths. Another upsetting trend, record high deaths involving opioids. That includes heroin and fentanyl, a synthetic opioid often found in pill form and up to 100 times more powerful than morphine. Narcotics agencies say counterfeit fentanyl pills are now mass-produced on the black market, the Russian roulette of drugs.
You never know which pill is going to have a deadly dose versus those that don't have a deadly dose.
Chris Gibson is executive director for the Oregon-Idaho High-Intensity Drug Trafficking Area program. He says the amount of fentanyl law enforcement is seizing shows an exponential rise in black market production outside the U.S. Take a look. In 2018, police seized 690 fentanyl pills. The next year, that number rose to 102,600 pills. Then, in 2020, they seized more than 734,000 pills. But what about the drugs they aren't seizing? Preliminary data from the Oregon Health Authority show opioid-related deaths in Oregon increased by 40% from 2019 to 2020. You can see the biggest difference in May during peak pandemic restrictions. In 2020, 63 people overdosed on opioids that month, compared to 15 in May of 2019.
When we're looking at the COVID pandemic and all those factors coming together at the same time, I think maybe something close to a perfect storm. We need to be working hand in hand between the enforcement side for supply reduction, but we also definitely need to be working together with treatment, harm reduction, and prevention.
It's tragic.
Dr. Amanda Risser is Senior Medical Director of Substance Abuse Disorder Services at Central City Concern, an organization that serves Portland's houseless community.
It's very sad. These are people I know and really care about who are dying from overdose deaths.
While not everyone struggling with drug addiction is houseless, Risser says it's a common struggle among her patients. She says most people who die from overdoses do so alone, even more so last year. And given the dangerous and unpredictable drug supply, she says it's critical to address this epidemic.
I think just really being aware that there's not enough treatment and that these last couple of years have been really hard for folks in our community who are struggling with substance use disorders. A lot of our systems that keep people safe and supported are falling apart.